afternoon, everyone. I am very happy to speak to you this afternoon and share with you my experience with PURTIER placenta. I was introduced to this product by Dr. Leo Olarte. He's also a lawyer. It was sometime during our International College of Surgeons convention back in 2017. When he met me and he told me, go, there is a new product, a oral stem cell. And I said to him, oh no, there cannot be an oral stem cell because all stem cells will not survive orally. They need to be injected. And he said to me, no, there is. I said, oh, how sure are you? And so I told him, you talk to me about it more. And he said, okay, I'll call you, I'll text you. But after that, we forgot all about it. The last week of January, he called me and he said, go, we are meeting, we are having a product presentation in Ozamis. Can you attend? I said, okay, I will go. You see, I have so much interest with stem cells, not only because of my readings, but because of the kind of work that I do. I am a neurosurgeon, and I deal with problems with patients, brain problems, which more often than not leave them with neurologic deficits, meaning they either get paralyzed or weak on one side of the body or weak on both lower extremities, or meaning the thighs and the legs and the feet, or maybe they cannot speak, and many other things referable to the brain. And when my patients' relatives ask me, Doc, after surgery, can my patient walk? Can our patient talk? Can my patient see? I always, more often than not, say to them, whatever that we have now before surgery are likely to be still there after surgery. Maybe when we have stem cells, I always tell them that, because stem cells are able to replace those brain cells that are destroyed or that may be removed during surgery. So he might be able to recover function. But up until the time, we will have to live with the reality that the deficits will still be there. So the purpose of our surgery then is not so much recovery of those lost functions, but survival. And hopefully, some functions will come back. And so I attended, and sure enough, I listened to the lecture of a presentation of Dr. Olarte, and I did have some questions, but by and large, I was convinced to try the product. I said, I am not one person who is easily convinced or swayed into trying any product, because you see, there are thousands and thousands of such kind of products, networking products. But for this ones, my wife was with me, we talked it over, and we did bring with us a few bottles of this PURTIER placenta. So on our way home, we were talking about who to give it to. We were thinking about my mother. At the time, she was 91 years old. And my auntie, her younger sister, my uncle, my mother's younger brother. So those were the people we had in mind that we will give this to. My mother at the time had been to the hospital, and she was, when she recovered, when she went home, she already was so weak. We need somebody to prop her up, sit her down, stand her up, and when she walked, somebody to support her. She was not eating well, and she was not sleeping well. And so at 91, I was saying to myself, well, this could be the end of my mother already. But we tried it on her. And you know what she said to me? After 2 weeks, she said to me in the dialect, in the Cebuano dialect, "Boy, nindot na gyud ang akong tulog." I said, "Oh, I see no difference, Mama." Because my mama, just snores, she just lies down and closes her eyes and she snores. And we, of course, interpreted as that she is really asleep. But she said, "No. You might hear me gahagok," she said, "but I'm really actually just listening to you. I'm listening to what you're talking, the noise that you're making. I do not have good rest. But now," she said, "I am very well rested." And I saw that she was already eating well. And after a few more weeks, she was getting up the bed by herself and walking to the dining table by herself and doing many other chores that she was not able to do before. And in fact, she now able to climb up the 4th story of our house and then drops by the 3rd floor, wakes us up and say, "Oh, human akong exercise, kamo nangatulog pa." And you see my mother now. She's 93 years old. She has had 2 accidents. She fractured her lumbar vertebrae, L2, and then just lately she fractured her L3, but she's able to completely recover in just a few weeks. She's up and about again. She's able to walk. She's able to do just like a normal, probably elderly woman. So I am so happy about that one. As regards my auntie and my uncle, because they cannot continually take the medicine, I just shared with them. Then they did not have the same results as that of my mother. Now, because there were still more bottles left, we agreed with my wife to also just try it. During this time, I already had some problems. One of those is the floaters in my eye. There were so many sight floating objects. In fact, when I operate, sometimes I sort of suck them out, but little did I realize that it was in my eye, not in the operative field. So, but I already said to my wife, we are going to Manila because I probably will have my eyes operated on. Because it was going to be a problem already with my surgery. And another problem that I had was these arthritic pains that I have in my hands. In fact, I already had 2 surgeries. This one and here another one, because there were times that I cannot anymore really hold my instruments due to the pain and the deformity of my fingers. So for a long time, I have stopped playing tennis. I have stopped playing my guitar because I cannot anymore hold these instruments or this racket. Was this mouth ulcers. I had this started when I was still in college, up to when I was in College of Medicine, until I graduated in 1981, until my practice, and on to that 2018. At that time that this was introduced to me, I still was having that problem. And I said to myself, well, this is not really part of my objective insofar as the use of stem cells. But there's no harm in trying. And so I took 2 capsules. In fact, sometimes 3 capsules twice a day. And you know, this is one thing that I can really with you. That in 2 to 3 weeks time, my floaters just disappeared. Up to now, I do not see these floaters anymore in my eye. When I look, there are no floating sand-like materials that I can see in the distance. That's gone. Number 2, I do not have those pain anymore. In fact, I already played tennis. I already bought a new guitar because I can now play my guitar. I can now hold my instruments very well because I don't have that pain anymore. I can sleep well at night already because there's no pain that's eating on the joints of my hands anymore. Best of all my mouth sores are gone. All my mouth sores. You know what? I discovered that I developed allergy to malunggay because I eat so much malunggay morning, noon, and evening. If possible, I will eat malunggay for snacks. And I just developed allergy. And that was the reason why I had those sores. When I was in medicine, so much, and on the topic of mouth sores, but I never found a treatment for that. But now I am free. So, because of that, I can tell you that live cell therapy works. I can tell you in particular that PURTIER placenta works. And since 2018, up to this time, I am still consuming PURTIER placenta every day. They ask me, Doc, what's your secret? Well, I said, it's not a secret anymore. I am using PURTIER placenta. And my wife, please come here, my wife. I'll show you. This is my wife. She also is taking PURTIER placenta. And at 63 years old, I tell you, when I work, I do not have those kind of pains anymore. No back pains, no leg pains, nothing. Kanang gitawag og pamaol, I don't have that word anymore in my vocabulary. Thanks to PURTIER placenta. So for those of you who are thinking whether or not you'll use it, take it from me. I am somebody who cannot be just easily convinced. And you cannot tell the others if you do not experience it yourself. So take it from me. PURTIER placenta works. It's effective. It will not only make you younger, but it will make you healthy and, of course, happy. So thank you for this opportunity. To the Reway group in the Philippines who are listening now, do not get your eyes off this product, especially in this pandemic. This is the one that will keep you safe and secure. So, I'll say goodbye.